clinico-radiological. So try to interact more in the session. We will have a healthy interactive discussion. So first, what I am going to do is, I will cover the previous year questions. There are around 10 questions which has been asked in the last two sessions in 2023 as well as in 2025. First, we will see that. So please comment the answers in the chat box. We will try to know how good you are, and we will try to improve your knowledge after the end of the session. So this is the first question. So is everyone able to see the questions now? 1 second. Yeah, this is coming. Yeah. First question was, gadolinium containing contrast agents are associated with. Actually, usually we will expect MRB exams to be little easier. Okay. And I was not expecting this question last year. And all of a sudden they asked a question like this. Okay. So gadolinium containing contrast agent. Actually, tell me, where will you use gadolinium? Yeah, everyone, all of you are right. Excellent. All of you know the things. So, எங்க யூஸ் பண்ணுவீங்க gadolinium? Okay, NSF, that is correct only. Yeah, very good. So gadolinium is a contrast agent that is used in MRI. So there are multiple investigations available like ultrasound, CT, X-ray, MRI. All these are investigations which are available. Among all these investigations, MRI is the investigation where we use gadolinium as a contrast agent. Now, another question. In which sequence of MRI we will give gadolinium? If you, you are not audible? Okay, I will try to increase my volume. Yeah, there are many sequences yeah, very good. There are many sequences in MRI. In which sequence you will use? Yeah, it is, it actually in fat suppress, but the thing is you have to give gadolinium in T1 weighted images. Okay, T1 weighted images. That is another MCQ. You have to use that in T1 weighted images. Now, one more question. Which blood test will you do before giving gadolinium? Not only gadolinium, any contrast agent. ஏதாவது ஒரு கான்ட்ராஸ்ட் கொடுக்கிறதுக்கு முன்னாடி என்ன இன்வெஸ்டிகேஷன் பண்ணணும்? மினிமம், RFT. So if a patient is having high RFT, then it is not safe to give gadolinium because it can cause what? One, it can cause us renal failure. It can precipitate the renal failure. Then second, the notorious complication is nephrogenic systemic fibrosis. Okay, I will show you one image of nephrogenic systemic fibrosis. So what happens in nephrogenic systemic fibrosis is there will be fibrosis of different parts of the body like skin, subcutaneous tissue and all. All of a sudden the patient will become like this. He will become stuffed with reduced mobility. So it is not safe to give gadolinium. It's very important. So 3 points: gadolinium, MRI, flare. If you have seen MRIs, there are many sequences. Remember, gadolinium is given in T1 weighted images. Another important point, you have to check renal function test before giving gadolinium. Yeah, 1 second. I will try to switch it off and on again. 1 second, please wait. Is it fine now? Okay. Okay, I think, yeah.
Fine.
Yeah. So we will move forward to the next question. So remember, gadolinium can cause nephrogenic systemic fibrosis. கண்டிப்பா RFT பார்த்ததுக்கு அப்புறம் தான் நம்ம வந்து கான்ட்ராஸ்ட் கொடுக்கணும். Okay. Next question was also little surprising for us in MRB because I think even NEET doesn't ask a question like this. Even in INA also they haven't been up to this mark because they asked the ultrasound appearance of endometriosis. So can you give a guess? Coarse internal echoes with the solid areas, cyst with the low level echoes and thick wall, pins and needles, mural nodules. Now there is a confusion. Some of you are giving A, some of you are giving 2, some of you are giving 4. Yeah, 2. Again, a confusion between 1 and 2. So remember, endometriotic cysts usually have low level internal echoes, okay, and a thick wall. Actually, There are three important cysts that you should remember when you are discussing ovarian pathologies. One, what is the most common cyst that usually almost every female will be having? Which is the most common cyst of ovary? No, not dermoid. Dermoid is not that common, but something very simple. Yeah, simple cyst. That is the correct answer. Okay, simple cyst, simple follicular cyst, you can call that. Follicular cyst or simple cyst is the most common cyst that everyone will be usually having. Usually it will rupture. Only if it is more than 3 centimeters, it will be of concern. Otherwise, it will not be of concern. So simple cyst will be something which is very simple. It is only filled with the fluid. So it will not be having anything else. Okay, that is what is simple cyst. Now, coming to the second one, that is the hemorrhagic cyst. So hemorrhagic cyst will usually have hemorrhagic components. So it will be having a lace-like or a reticular pattern in ultrasound. Okay, simple cyst will be very simple without any septations. No mural nodules or no pins and needles, nothing will be there in simple cyst. But in hemorrhagic cyst, please write, in hemorrhagic cyst, there will be lace-like pattern or reticular pattern. And finally, coming to our endometriotic cyst, usually endometriotic cyst will be having lower level internal echoes. Lower level internal echoes. I will show you an image. I will show you an image. So imagine if a cyst is having, usually we will do ultrasound for finding out cyst. You can also do MRI to characterize it further. But when you do a ultrasound, if you are seeing a nodule like this, imagine there are few nodules like this. That means that is of high grade lesion, or it is more suggestive of neoplastic etiology. It is more of a neoplastic lesion. So if there is a mural nodule, you should think in terms of neoplastic. Okay. So if they ask you, usually they can ask you what is the first investigation that you do for an endometriotic cyst or hemorrhagic cyst. So can you tell me, when you are sitting in your OPD, a patient is coming to you, you are suspecting a hemorrhagic cyst for it? Yeah, very good. So if they ask you any ovarian pathology, the first investigation will be ultrasound. Now coming to the investigation of choice, if they are asking you which of the following is the investigation of choice for hemorrhagic cyst or endometriotic cyst or ovarian cancer, what will you tell? Yeah, very good. So remember, USG is the first investigation and MRI will be the investigation of choice. Okay, MRI will be the investigation of choice. Biopsy will be the gold standard. Okay, so there are three strata for investigation, 3 levels. First one will be the first investigation that we will be routinely doing. So it will be a non-invasive thing. It should be easily available. It should be low of cost. So it should be repeatable. So ultrasound. Then coming to, if the question is asking investigation of choice, that is IOC, then it should be of a high quality level, still non-invasive. And coming to biopsy, biopsy is the gold standard. Okay, biopsy is the gold standard. Biopsy is the gold standard. So this is the concept. Any ovarian pathology, any uterine pathology, we will follow the same order. Ultrasound will be the first investigation, MRI will be the investigation of choice, and biopsy will be the gold standard. Now, sorry. Yeah. Now, so first one is the simple ovarian cyst. See, this is a simple cyst. Simple cyst means only it is having fluid as a content. There is nothing else, only fluid is the content. Now, coming to the second one has some septations. So that is a hemorrhagic cyst. And finally, the third one, it has diffuse low level echoes. Diffuse low level echoes. So that is endometriotic cyst. That is endometriotic cyst. Okay. Now coming to the third question. So there were 3 direct questions from radiology last time. So can you tell me the answer for this? This is something which you commonly see. That is chest radiograph. You have to tell this. Okay. So yeah. So in a chest radiograph, there are 2 hyla, right hyla and left hyla. So all of you are telling that Yeah, some of you still have confusion. Just remember, always understand that left hilum is at a higher level than the right hilum. Left hilum is always higher than right hilum. It is because in right side, there is an epiarterial bronchus. The bronchus is little more higher, and in left side, the artery is more higher. In a radiograph or in an X-ray, the hilum is formed by the artery. You are seeing only the shadow of the artery. So left pulmonary artery is slightly higher than right pulmonary artery. So in almost everyone, left hilum will be, that is around 95 to 98% of the population, left hilum will be slightly higher than right hilum. One more question, let me ask you. Which hemidiaphragm is higher in position? Can you tell me which hemidiaphragm? Because you have two hemidiaphragms, right and left. In a radiograph, which hemidiaphragm is higher in position? Okay, all of you are telling right. Yeah, some of you are telling left. Why left? You know, in a radiograph, right is always high. Okay, why? Can you tell me the reason why the right hemidiaphragm is situated higher up than left hemidiaphragm? Yeah, I wanted you to tell the liver. No. It is not because of liver. It is something else. It is because of the cardiac pulsation. Okay, it is because of the cardiac pulsation. The left hemidiaphragm is slightly or inferiorly positioned. So it is because of the constant cardiac pulsation. It is not, don't think that liver is sitting under that and pushing it above. Liver push pannada. It is the constant cardiac pulsation. So please be strong in two things, because anyway you are going to see any number of radiographs in your career. So two important principles. Left hilum is higher, left hemidiaphragm is lower. Left hilum is higher because of left pulmonary artery slightly upper than right pulmonary artery. Left hemidiaphragm is lower because of constant cardiac pulsation. Don't think that liver is pushing it up. Okay, so 2 points from this slide. So this is bronchus right side is upper, because there are two types of two subdivision of bronchus on right side. That is epiarterial bronchus. Epiarterial means above the artery. So on right side, bronchus is higher. So don't confuse, just think left hilum is above. Okay, I think you got the concept. So these are the three MCQs which they asked last time. And this one was relatively easy, but the first two questions were a little bit tough. Even NEET kuda and நான் பார்த்ததில்லை இந்த ovarian endometriotic cyst or appearance எல்லாம் அவங்க கேட்டதில்லை. Okay, so now we will go to 2020. So okay, so yeah, I will show you the image also. See, this is the right hilum, this is the left hilum. So you know left hilum is higher than right hilum, there is no doubt. And this is the right hemidiaphragm, this is the left hemidiaphragm. The heart is pushing little bit down, the left hemidiaphragm is slightly pulled down. Now one more thing, if they ask you, usually NEET and all, they ask you, they will draw an arrow like this, and they will ask you which rib is this, whether it is an anterior rib or a posterior rib. What do you think, whether it is an anterior rib or a posterior rib? The yellow arrow which I have drawn. Again, most of you guys are correct. It's a posterior rib. Remember, posterior ribs are horizontally placed. So this is a posterior rib, this is a posterior rib, this is a posterior rib. Posterior ribs are horizontally placed and anterior ribs are obliquely placed. So in a radiograph, these are the anterior ribs. Okay, these are the anterior. This is the first anterior rib. This is the second anterior rib. This is the third anterior ribs. So anterior ribs are obliquely placed. Posterior ribs are horizontally placed. So tomorrow when you are going to the duty, please look at radiograph and try to delineate the anterior and the posterior in the paathukonga. Okay, wow. So posterior ribs horizontal, anterior ribs oblique. Anterior ribs are oblique. Yeah, you can think like that. Yeah, please don't comment about the Tamil part, because I will feel bad. Because usually my friends used to tease me for my Tamil from the first year. Anyone from Tirunelveli in the comment box? Yeah, okay. So now, are you able to see the screen correctly? Yeah, wait. Okay, now, okay. So 3 questions were asked. Almost everything were easy only, but you have to know the basics. Now we will go to 2023 recall. There were 2 sessions, morning session and evening session, and there were some questions. Okay, now this is actually one simple silly question. What is the abbreviation of FAST? Okay, it is given there. focused assessment with sonography for trauma. And actually, these were the types of MCQs which were used to ask when I was preparing for PG exams. Okay, when NEET-PG exams, they were so straightforward, direct questions. Yeah, focused assessment with the sonography for trauma. Yeah, you know that. Now, let me ask you some questions. Who will do it fast? Okay. Imagine you are in casualty. நீங்க உட்கார்ந்துட்டு இருக்கீங்க. யாரு தான் பண்ணுவீங்க இந்த fast? First கேள்வி. Excellent. Anyone. Any doctor in that department, CMO or MO, who are in charge, you have to do the fast. Okay. Now, second thing, all of you are preparing for MRB. Okay. No, there is no need for emergency medicine PG or intern or anyone. MO, that is correct. Any medical officer who is there, you can do it. Now, where will you keep the probe first? Understand, fast is done with the help of ultrasound. That is the second point. Yeah, first you have, okay, I will try to adjust my camera. So first you have to keep it in the syphisternal region. Yeah, subxiphoid region. To see what? That is the second question. First you will keep it in subxiphoid position. That is correct. To see what? That is my question. Very good. You want to look into the heart. Okay, you want to look into the heart. And while looking into the heart, you are looking for any pericardial tamponade or pericardial effusion. So that is very, very correct. Okay, you are excellent. That is a great thing. And because all of you are going to do fast in your, whether you are becoming an MO or whether you are getting a PG seat, whatever it is, you have to know how to do a fast. Okay, first you will keep it in syphisternum. You will look for pericardial effusion. That is done. Second, where will you keep that probe? Very good. Then after that, you have to keep it in right upper quadrant. I think this is, you can see me. Okay, right upper quadrant. To see what? Yeah, hepatorenal pouch. Very good. Very good. That is hepatorenal pouch. So first you will keep it in syphisternum to look for pericardial effusion. Very good. Then you will keep it in second. You will keep it in Morrison's pouch. Okay, or hepatorenal pouch. Morrison's pouch to look for free fluid. Then third, you will keep it in left upper quadrant. Okay. You will keep it in left upper quadrant. And finally, where will you keep? Fourth. Last. Finally, where will you keep? So you kept in syphisternum, right upper quadrant, left upper quadrant, finally where? Very good. In pelvis or suprapubic region to look for free fluid. So actually, next question. When you are creeping the probe here and there, what are you expecting to see? Appendix, renal calculi? No. You have to find out free fluid. Okay. Our aim is to find out free fluid. So hemoperitoneum. Imagine you are seeing free fluid. Very good. You are a good physician. You are seeing the free fluid there. You are going to save the life. And the time, next, what will you do? Imagine the BP of the patient is 118 and pulse rate is 73 or 72. What will you do? Okay, you will resuscitate. I'm asking. But okay, after resuscitating, stabilizing the patient, already the patient is stable. DLAP. Okay, so patient's BP is stable, vitals are stable, pulse rate is stable. Why DAP? Very good. So first you will do fast. If the patient is stable, you have to do contrast enhanced CT abdomen. You have to do contrast enhanced CT abdomen to see whether any of the organs are damaged or not, like liver, spleen, pancreas, kidney, anything. Okay. But yeah, after RFT, but in the trauma setting, even RFT is not needed because our priority is not saving the kidneys. Our priority is save life. So usually in trauma, we will not ask for RFT because even if it is something is there, you can do dialysis. It is not as complicated as gadolinium. So which contrast agent will you use in CT? Now we are into CT. We finished ultrasound first. Now we came into CT. So which contrast agent will you give in? Very good. Any iodinated contrast agent like iohexol, iodixanol. Usually in government setup, we will use iohexol. So any iodinated one. Okay. So we will do this to look for organ injury. We will see for any organ injury. Now, imagine the patient's BP is, imagine the patient's vital is, I will write it here, 80/40 and pulse rate is 27. Yeah. So the patient's vitals are falling. His BP is only 80/40. Vitals is very poor, like 20-25 pulse rate. So you have to do exploratory laparotomy. So next management will 100% depends upon the condition of the patient. First one, the first பண்ணிடுங்க. Fast positive na, patient stable na, you have to go for a CECT. If the patient is unstable, you have to immediately intervene. You have to do diagnostic laparotomy. Okay, that is the concept. So this is about fast. This is very, very important. Okay, in 2023, the people were very lucky. They asked the abbreviation like focused assessment with the sonography for trauma. They may ask further. So please study everything about fast. Okay, fast is very, very important. So we will move forward. Now, left outer quadrant is also, that is the area is called as splenorenal pouch, the gap between spleen and left kidney. Look for fluid only. Fast is done to see fluid. Fluid. We are only looking for fluid. Appendix, fluid. Fluid means hemoperitoneum. Usually patient will not be having free fluid, right? So after trauma, there will be hemoperitoneum, which can easily be picked by ultrasound. That is the concept of doing fast. So usually in MRB, they will not e-fast. Yeah. Okay. So very good. I forgot to tell that. Now we are adding two more things. Okay. Not two more things, one more thing. Finally, we will keep the probe in lung fields. Okay. We will keep it above the lung fields. We are searching for pneumothorax or hemothorax. Upon there is a sign called as seashore sign is for normal. There is a sign called as barcode sign, which tells that there is pneumothorax. There is a side called barcode side, which tells that there is pneumothorax. Okay, barcode sign. And normal lung will show a sign called as seashore sign in ultrasound. Okay, here's the normal lung. If it is normal, that sign is called as seashore sign. Seashore sign. That sign is called as seashore sign. So that is called e-fast. Now fast has been modified into e-fast. Abdomen we are seeing the lung fields also. So we will keep the probe in the lung fields. We will look for pneumothorax or hemothorax. Pneumothorax will be seen as barcode sign, also called as stratosphere sign. Okay, stratosphere sign. See, knowing multiple signs is not of very important. You should know what you are trying to do. Okay, we should know what you are, which area in lung fields. We will see in the dependent area. Okay, you can keep it anywhere. Usually we have to find out whether there is a fluid is there or not. So what we will do is we will keep it here. Okay, near the nipple or just below the nipple area. Okay, you can keep it there. Okay, so shall we move forward to the next one about silhouette sign? Usually in MRB pattern, we will not expect to get images. Okay, pictures usually it is an old school method. MCQs direct, you will the one-liners or just facts or points. But as a surprise in 2023, they gave two images. Okay, one was of this. So they gave an image like this. I will show you. And they asked here which lobe is involved. That was the question they asked. Okay, so a patient with a fever, cough. So patient with the fever, you are taking a radiograph, cough, sputums, you are suspecting pneumonia. So they are asking you which lobe is involved for a patient with this consolidation. So this is consolidation. There is no doubt. I will tell you how this is consolidation. That is another story. But yeah, okay, all of you are telling that this is right middle lobe. So let me ask you, why it is not right lower lobe? Yeah, the right lower lobe. At least some of you might think in your mind, right? Yeah, the right lower lobe. Very good. So to localize a lesion into the thorax, to locate a lesion into the thorax, there is a sign called a silhouette sign. So what happens is, if there is a pneumonia or a lesion in right middle lobe, it will obscure the right heart border. See, you are not able to clearly delineate which is the consolidation, which is the heart border. Similarly, if there is a lesion in left lingula, it will obscure left heart border. If there is a lesion in left lingula, it will obscure left heart border. Now, finally, if there is a lesion in lower lobe, it will obscure the diaphragm. Very good. So most of you know the stuff. That is very important. So if there is a consolidation or any lesion is present in the lower lobe, it will obscure the hemidiaphragms. So that is the concept. So this is called a silhouette sign. So the exact same image was given for your exam in 2023. So you can expect that sometimes they will give you images. Okay, that is the concept. Sometimes they may give, sometimes they may not give. So I will go back to the question. You read the question one. Silhouette sign obscuring the cardiac border in chest radiograph is seen where? So if the cardiac border is obscured, if it is in the right side, then it is right middle lobe. If it is in the left side, it is left lingula. That is the concept. Okay, if it is on the left side, it is left lingula. So be strong with silhouette sign. Now, one more question. Why lengths appear black in a radiograph? Have you ever wondered why lengths appear? Then why consolidation is appearing white here? Anyway, all of you are treating physicians. You know how to treat a patient. You know how to give antibiotics and treat consolidation, whether it is bacterial or viral. So, yeah, usually what happens in a normal lung is the normal lung is filled with air. See, the normal lung is filled with air. So, those areas will appear black. So, what happens in consolidation or what happens in pulmonary edema? Instead of air, the alveoli get replaced by fluid. Okay, the alveoli is replaced by fluid or pus. Okay, or exudates. Okay, so exudate. So those area which is replaced by pus or fluid in cases of pulmonary edema, pus in cases of pneumonia, will be seen as white or radio opaque or white in a radiograph. That is the concept. Very good. So the black, these normal areas because of air, this white area is because of pus or fluid which is present within the alveoli. So this is the basic concept of a radiograph. Okay. So from tomorrow when you are looking at a radiograph, when you are seeing an opacity, you have to understand that in that region, instead of air, the alveoli is filled with pus or fluid. Okay. So that is the minimum basic thing that you have to understand about radiograph. So now you know how to find out a pneumonia, you know how to locate a pneumonia, and upper lobes is very easy because anyone who see an opacity here will tell that this is an upper lobe. So you don't need to remember anything about upper lobes. Middle lobe and lower lobe can be confusing. If heart border is obscured, that is middle lobe. If hemidiaphragm is obscured, that is lower lobe. I hope the concept is clear. So shall I move forward to the next question? Or should I repeat? If anyone finding out any difficulty in understanding silhouette sign or understanding the concept of pneumonia, you can please tell openly in the chat box because I was worse than you when I was an intern or after an internship. Okay. So these things we will learn by experiences. So please, you can ask. Yeah, I will move on. Yeah. Another very important thing is they asked an image of intracranial hemorrhage. Okay. They asked an image of intracranial hemorrhage. Yeah, repeat. Yeah, I will repeat. Usually, normally in a lung, the functional unit of lung is alveoli. You know, everyone knows from physiology. So, if the lung contains only air, that is, if the alveoli is filled with only air, then the all lungs will be black like this. Okay, it will be very beautifully black like this in a normal person. What happens when the person is infected with pneumonia or if there is a pulmonary edema? Instead of air, the alveoli will get replaced with pus or fluid. The alveoli will get replaced with the pus or fluid. So what happens in that region? There will be no air, so that region will appear white. That is a simple concept. Okay. So it is the pathology which is happening is the reason for the radiographic change. Okay. Instead of air, the alveoli is replaced with fluid or pus. Yeah. Okay. So I will move forward. Yeah. So what hemorrhage is this? Can you tell me? So what is this hemorrhage? Because answer is already given in red color. Yeah. Why it is EDH? There are three types of hemorrhages in the brain, right? Extradural, subdural, and subarachnoid. Yeah, you are very sophisticated guys. You are telling biconvex. Very good. Simply in exam, you should never forget. Idli mariye irukum. Alla white and the shape layer. Idli mariye apdi irundichuna, that is EDH. Okay. EDH looks like idli. So in exam, don't confuse. This is EDH. Okay. So now let me ask you, how will you treat this patient? Okay. Patient on the after trauma is coming to you, his GCS is very poor. CT எடுத்துட்டீங்க, CT ல வந்து EDH இருக்குது. எப்படி சேவ் பண்ணுவீங்க? எப்படி வேற காப்பாத்துவீங்க? Okay, not burhole. Burhole ஓட better ஒன்னு இருக்கு. Okay, craniotomy. You have to go for craniotomy. Not burhole, better craniotomy. Burhole is best for SDH. This is not wrong. I am telling better. Better is craniotomy. Okay. Now, Which hemorrhage will look like this? Which hemorrhage will look like this? Which hemorrhage? Yeah, very good. This is SDH. Don't worry, I will discuss 50 important points. So there is questions about EDH and SDH. We can discuss it there. So what I am trying to tell, image what is this? So if you don't know how EDH looks, how SDH looks, please attend the class till the last slide. I have